Your Excellencies, the Rector, the Chancellor, the Vice Chancellor, faculty of the University, the Pontifical Catholic University of Chile, the doctoral students, dear friends, I'm Soumya Swaminathan. I'm the Chief Scientist at the World Health Organization. And first of all, thank you so much, and such a great pleasure to be able to address you today. And first, I should start by congratulating this class that's graduating. You are the scientists, the technologists, the humanists of the future, future political leaders, and the shape of society in the years to come is really going to be in your hands and in the hands of your peers around the world. I think it's important at this stage to recognize that, because you, like all of us, we're all living through a very unique period in the history of humanity. And while there have been pandemics in the past and there have been pandemics in the future, this pandemic will be remembered, I think, for many things. And maybe I can speak about a few of them. I think the first one really is the role of science and technology that's played in this pandemic. The fact that we had the whole genome sequences of this novel coronavirus in a couple of weeks from the time that the first cases were described in China on the 11th of January 2020, the world knew that this was a novel coronavirus, and therefore we could understand a little bit about what to expect, and also we could start preparing. We could start preparing the diagnostics and even vaccines. The first mRNA vaccines started getting developed within a few days of this new knowledge and went into clinical trials within 2 months. So that is unprecedented and has given us the confidence that for future pandemics, science will play a very important role. And this is why nurturing the next generation of scientists of different disciplines and fields, and accepting that science is today multidisciplinary, that if you are a trained biologist, even within biology, you specialize in narrow areas, especially when you're doing your graduate studies. But later on, to be very effective and impactful, you will see that you will need to collaborate with a number of other experts from different disciplines, including the social sciences. I always like to remind ourselves that what we consider as the pure sciences, we often leave out social sciences, which are extremely important. And just the other day, we had a global webinar on how ethics is so important for policy making. So because when policy making is based, of course, on data and evidence, and that's what we would like, but at the same time, there are sometimes considerations that we do not think about as scientists or as a policy maker or as a politician, that somebody who comes from an ethics background and a social science background can think of. So I think the first message really is that science and technology can provide solutions for many of the problems that we are facing today in this world, including things like climate change, antimicrobial resistance, the destruction of our habitats, the fact that we know so little about the diseases that are circulating in animals, and so on. The second is that the world was unprepared, clearly, whichever country you look at, except for maybe a handful of countries that had put in place good mechanisms to be prepared against epidemics and pandemics, because they had had bad experiences in the past and they had put in place systems to prevent that from happening again. So especially I'm talking about the countries of Southeast and East Asia that had experienced SARS in 2003-04 and then MERS in 2012-13. They were the best prepared, really, to face this. And countries around the world have all been challenged by this virus at different times. We've seen peaks and waves of the infection happening in all different regions. And in fact, the worst hit regions have been Europe and the Americas. And it's often, people often wonder about why Africa was spared. And I don't think they were spared, but they had all along the experience of infectious diseases that they've been tackling. HIV, malaria, TB, all of these need systems in which the public health cadre, the community health workers are closely in touch with the communities, and a system of delivering care through the primary health care system, because there's a lack maybe, or less emphasis on tertiary care but much more on primary care. And that's related to, of course, availability of resources. On the other hand, we see high-income countries with excellent tertiary care facilities have had some of the highest death rates in the world. So we need to rethink how we will achieve universal health coverage. Investment in health is now clearly a priority, hopefully, for all countries. At the highest political level, there's commitment, but investing in health does not necessarily mean building more hospitals and intensive care units. It means investing in public health, in sound surveillance, in data systems, in supply chains and logistics, in the health workforce. The health workforce has been working around the clock now for the last 2 years, saving lives. They're tired, and in many countries, there are not enough doctors and nurses really for the population. So really investing in health workforce, not only doctors and nurses, but you need lab technicians, you need community health workers, you need physiotherapists, you need nutritionists, you need psychological counselors, you need people to work in the community, you need data analysts, you need epidemiologists. So health systems really need to start identifying where their gaps were and start correcting those so that we don't face the same thing in the future. And as you know, recently countries met at the World Health Assembly to think about a future, a pandemic treaty or an agreement of some kind that will bind all countries. Because that brings me to the third point, and that is that you need global collaboration and solidarity in order to solve global problems. We cannot do it country by country, and we cannot do it when there is no common agreement on the equitable and fair sharing of the scarce resources. In the beginning, we had scarce PPE, the protective equipment. Then we had scarce diagnostics. We have scarce medicines and monoclonal antibodies. We had limited supplies of vaccines, and we found repeatedly the same pattern of oversupply in some countries and undersupply of other countries. And this is why WHO set up the ACT Accelerator. We set up the COVAX facility in order to be able to procure and distribute vaccines equitably around the world. But this requires cooperation. It cannot be done without countries cooperating, without manufacturers and the private industry cooperating, without trade barriers not coming in the way, without intellectual property not coming in the way. And it's been very sad and disappointing to see that we have not been able to come together to resolve some of these problems, despite the fact that the pandemic has taken so many lives. I mean, 5.2 million lives is just the documented and notified deaths. We know the true death toll is much, much higher. We know that the true impact on lives and livelihoods is much, much higher. And despite that kind of a global shock, we were not able to. And we should not repeat this mistake again. And therefore, we need some rules of the game. And the same would apply for climate change. We've seen the negotiations at the COP26. It's so difficult to get agreement and alignment. And again, it's a threat that's going to affect all of us. But of course, the vulnerable and the impoverished are always disproportionately impacted by any threat. And those who are better off are able to be more resilient. So again, the inequities have been deepened, they've been sharpened, and they've been brought to the forefront by this pandemic. So I don't want to sound very, very pessimistic, but I think that this pandemic, I hope, will change us for the better. And again, I come back to the fact that you, the young people of today who are now going to shape the future, are the best hope for us. And I know that that you do the right thing. You will want to do the right thing. That's the impression I get when I see young people around the world. They don't want to repeat the mistakes of my generation. So wish you all the very best in your future careers, wherever that may be. And I hope to meet some of you in the future. Thank you very much.